Welcome to the Off Leash Podcast with Dr. Pete. I'm your co-host, Molly, and we're so glad that you joined us for today's show. Remember, we're not here to say what you want us to say. We're always here to be an advocate for your pet. How's it going?
Good. How are you?
Good. So you have some pretty exciting news for a paper that you signed last night.
Yeah. We signed we have a a manuscript that's being reviewed by the AVMA Journal to a certain extent about copper storage disease, something that I've co-authored with another veterinarian, Dr. Sharon Center. And so she and I are working on some stuff and had a lot of help, a lot of good people helping us with this project. Some of the people at the veterinary clinic and everything. So when this gets published, it'll be kind of exciting stuff. And we'll make it a little more well-known about where to find this article and probably try to get copies of that and make it available for some of our customers and stuff. So
we'll probably do a whole podcast on it.
I'll bet we will.
So keep in mind with that. I don't know when it's going to come out, though.
I don't either.
It's going to be, we'll just keep you updated. We'll keep you updated.
Just so people know, a peer-reviewed article means that a bunch of other people look at it, learned people, and then they give their criticisms of it, and then they may ask to have it changed, or they publish it as written. And so great minds kind of get together and decide what would be the best way to present this information. So that's what goes on.
Exactly.
So when it says peer-reviewed, that's what it is, peer-reviewed.
Exactly. So we will keep you on the up and up about that. As soon as more information comes out, we will let you know.
Sure.
Today, we are going to be talking about elderly dogs.
Sure.
We get a lot of requests to talk about this, mostly in the fact that people, they want to put their dog on an elderly dog formula.
Sure.
Or a senior dog.
Senior dog. Well, yeah, there's a lot of talk about that. In fact, there's a company now, there was an article in Fortune magazine about a company named Loyal, and they're trying to make pharmaceuticals that help dogs live longer. Oh. So I guess maybe the first order of business here would be to talk about what is an elderly dog. Well, if you got a Chihuahua, an elderly dog is a dog that's like 17.
Yeah, well, small dogs live longer than large dogs because large dogs have joint problems, hip problems.
Musculoskeletal problems. Yeah, that's exactly right. And then a big dog, like if you have a great big dog, I got dogs that are 150 pounds. They're elderly when they're 8.5 years old. So,
how old do Great Danes live for?
Now, if you get one of those to live to be 11 or 12, you're a hell of a dog owner.
I feel like most of them I hear die at like 6, 7.
And they die of all sorts of things. Diabetic cardiomyopathy, musculoskeletal failure, all sorts of things. And
that's not in a long enough time.
They even get something called wobblers, which is an instability of the cervical vertebrae in the neck. So we see all sorts of stuff with them. Yep.
That's sad. If you were to break it down, what's like the worst type of dog to own when they get old? As a veterinarian, health condition wise.
Health condition wise, I mean, if
wiener dog.
Well, yeah, they hurt their back.
Jade just hurt her back.
Yeah, I think she hurt her hip, to be honest with you, because she was carrying her leg. But maybe she did hurt her back. I don't know. But so if you have dachshunds, and we start in with people on dachshunds from the very time you have a dachshund now, and so the first thing I told you is don't let your dog jump off furniture and stuff.
She does though. I bought all the stairs and everything. And I'm like, this is how you go up the stairs. And she's like, screw you. I'm not using these stairs.
No, I know.
I'm like.
So, and I think that's the thing you have to be careful. There's certain dogs, like you have a King Cavalier Charles Spaniel. And what you have with those dogs is they tend to develop heart failure.
Really?
Yeah. So you have to, so when those dogs come in and they're 5 or 6 or 7 years old and you're going to do a DHLPP or you got to clean the ears or you got to do something, you listen to the heart. What's the heart sound like? Is there a heart murmur there? Mm-hmm. And how bad is it? We kind of grade those out and try to determine what it is. And so same way with Dobermans, they get neck problems from time to time. What else do we see? We see golden retrievers, high propensity to develop cancer. Mm-hmm. You get boxers, high propensity to develop cancer.
No, not the boxers.
Yep. A standard poodle, they tend to get Addisonian. That's an adrenal disorder. And so you see all these things that occur. German Shepherds, exocrine pancreatic insufficiency, and all sorts of other stuff to boot. Mm-hmm. So we see all sorts of things. See all sorts of things in dogs, and I guess this is. I don't think we're gonna go down this road that's this far, but I think one of the things that clients need to know is when they see something going on. Well, my dog was drinking a lot more water than normal. Okay, I had one of those yesterday. My dog's drinking more water, and this dog had weighed 88 pounds, now it weighed 58
For
pounds.
some reason,
so
I feel like it did scream kidneys.
Yeah, but
if
it's
it drinks
not.
a lot of water.
Well, you don't make that decision. What you do is you run some blood work and see what it is.
Yeah.
So the job of veterinarians is go and take a good history and then but walk in stupid, like you don't have any idea what's going on with this dog.
Have you ever walked in and been like, this is what it is, and then you tested and you were like, oh man, it's
not what it is. That's right. That's why you test them.
But have you ever had the assumption, you were like, oh, I know it's going to be this?
Yes, all the time.
Really?
Yeah, but I try not to convince myself that anymore because now I have tunnel vision as to where I think I should look. So you look at everything. So your dog's drinking a lot of water. Honestly, if I had a dog that was drinking a lot of water and I couldn't get into a doctor's appointment for 2 weeks or something like that, you know what I do? I take in a urine sample, run the urine for me. So what are you going to find on urine? Okay, if it has diabetes, there'll be sugar in there. If it's in kidney failure,
UTI or anything?
Yeah, well, it could be, but if he's in kidney failure, the specific gravity will be less than about 10-20. Okay, screams of kidney failure. If you have a lot of white cells, you have either bladder infection or kidney infection. Okay, if you have a lot of bilirubin in the urine, hey, they got some liver thing going on. Honestly, for the money, I think sometimes, and especially if you can't get people in on a timely basis, you send the urine in.
Urine samples are so hard to get.
No, they're not. That's what they make soup ladles for. So
with a wiener dog?
Yeah, with a soup ladle.
It's like she's touching the ground when she pees.
No, you can't. Right. That's all right. You just slide either that or a tablespoon under there. Oh and then that's what you don't need much urine. Or you can take them into the veterinarian's office. A lot of times the technicians will get that. They do
with a catheter or something?
Well, actually do a cystocentesis. You stick a needle through the abdomen and right into the urinary bladder. It's usually guided with a ultrasound machine, and then you get your urine sample, and then you see what you got. Are there crystals in there? Is there bilirubin in there? Are there white cells in there? Is there sugar in there? Are there ketones in there?
Yeah.
So you look at all that stuff, and then when you look at it, you make sure you're stupid when you look at it because you want to look at everything.
Right.
Yeah.
But are all these common things for elderly dogs to have?
Yeah, sure. I mean, but I'm kind of talking about the polyuria, polydipsia, drinking a lot of water. That's what that is. Drinking a lot of water, polydipsia, polyuria.
Was this an older dog?
Yeah, this was a 8-year-old dog, and it had gone from 88 pounds to 58 pounds. So that's the first thing I thought. It's got diabetes.
So Sage has a birthday coming up.
Can we go back to talking about this?
No, you're good.
Okay.
You're good.
Okay.
I was going to say, what is technically an old dog?
Well, your dog's an old dog because she's got arthritis and is limping and stuff. So by virtue of everything that we know about Labrador Retrievers, was she 8 years old now, 7 or 8?
She's turning 7.
Turning 7. Okay, so she's got some miles on her.
Yeah.
Yeah. So this is like a car that's 3 years old that has 280,000 miles on it. So she was worked a lot, and so she has some miles on her. So she's a little older than she should be. If she just sat on the couch and watched TV with your mother and I, then it wouldn't have been a big deal. But she did a lot of work. Now she's still young at heart, and I think her kidneys are probably fine and everything. And I think we've done a little blood work on her from time to time, and she's okay. But you have to go ahead and take a peek, see what's going on. And that's the thing I was going to tell you. And this dog that we looked at the other yesterday, I went from 88 to 58. And quite frankly, this dog had normal kidneys. This dog was not diabetic. This dog did have an elevated ALT. And I think after talking to this young lady for a bit, I think what they did was I think we beefed about them the last time about being too heavy. So they got the weight off, and they got it off slowly. And I don't think that dog been in for about 1.25 years or something like that. So maybe been sooner than that. But anyway, it had lost all this weight. But it had a high LT, and the elk phos was about normal. So I think I wouldn't be surprised if this is one of those copper dogs.
Yeah.
So we're going to put her on a copper restricted diet, and then
our food.
Yeah. So we're going to put her on a copper restricted diet, and then we'll take a look at her in about a couple months, and we'll recheck the ALT again. And if it's down, then we'll know, okay, this is probably helping a lot.
Yeah.
This wasn't a crazy ALT, like some we see 500-600. In fact, I saw one the other day, it was like 1,400. That dog, I think, had leptospirosis. There's all sorts of things that cause that liver enzyme to be elevated.
Right.
So you just, honestly, it's so complicated that you just have to kind of look at everything and kind of put it all together. It's like a jigsaw puzzle. You put the outside together first, then you do the pieces inside later on.
Oh yeah, that's like any problem with vet work. You're trying to figure it out as you go.
But
so
a UA gives you a lot of indications of what's going on.
So tell me more about elderly dogs.
Well, elderly dogs, so it works out to be this. When they come in and I'm going to vaccinate let's say a 12-year-old lab, I look at the weight. It was 81 last year. It's 81 this year, or it's 83 this year, or it's 72 this year. So then I have to question the client. Okay, are you trying to get weight off your dog, or has it just come off, or did she get lame and can't exercise anymore? What happened here? And they'll tell you. They'll give you a history. It's what it is. And they do a good job. And I just have to make sure that I don't have headphones on and I listen to everything they say, because that's the most important thing.
Getting a good history.
Yeah, God gives you 2 ears and 1 mouth. There's a reason for that. Anyway, I look at all that sort of stuff. And then if I think it's indicated, let's say they're coming in for a heartworm wellness profile and we got a little age on us and we're wondering about a couple of things, I may say, well, let's go ahead and do a heartworm wellness profile, not just a heartworm check, but a heartworm wellness profile, which will include Lyme, Ehrlichia, and anaplasmosis, three other diseases that are caused by ticks. Then I get a CBC to see if there's anything wrong with the white cell count, the red cell count. Do we have enough platelets? Platelets are part of the clotting mechanism. So I looked at one the other day and it had platelets of like 24, and I thought, now we better count these and see if that's really what it is. And it was what it really is. And then dog had a temperature of about 104. So we checked it for Lyme and Ehrlichia and anaplasmosis, and it had just a faint Lyme positive. So on the test, it was like not a lot of conviction that that's what it was. So I said, well, let's put them on antibiotics. We put them on amoxicillin and enterfloxacin. One's a fluoroquinolone, the other's a penicillin type derivative. And within a day, that dog's temperature was back to normal. The only thing is, I did the CBC, repeated the CBC, and it still had low platelets. So I thought, I'll bet this dog, I wonder if this dog's, the temperature had gone down. I thought, I'll bet this dog's Lyme positive. So I went ahead and did my thing, repeated the CBC another couple of days later and still had low platelets, but they were coming up a bit. And then I just checked this dog yesterday, and this dog's platelets were up to 234 from 32 or whatever it was, 234,000. So I'm like, oh, good. And the guy goes, yeah, I got good news for you. He says, that dog's doing great now, out running around, doing all sorts of stuff. But he says, you know what happened to our family? I'm like, no, what happened to your family? And he goes, my wife had a business trip and she had to go out to Colorado and she didn't feel good the day she left. And when she got there, she had a temperature and kind of the shivers and stuff. And so they took her to the doctor's office or to the hospital or something like that. They checked her for Lyme. She had Lyme too.
Oh no.
Yeah. So
that's crazy.
Yeah, that is crazy. I mean, that's just bizarre because I wasn't 100% convinced that that's what that was. But since we did the blood work, we figured it out. And that's the way this works. You won't know what you don't look for.
Right.
And sometimes clients, I think there's a certain group of clients that don't want to know all that. They just as soon not be given bad news. But a lot of times the bad news I'm giving you as a treat, there's a treatment plan that comes with the good news is with the bad news, there's a treatment regime we can do. And in this case, this dog's going to be on amoxicillin until it's out, and then we're going to go doxycycline for 21 days, and we should be in the clear. And they need to do a little better job of controlling their ticks. I was really suspicious because they lived out, listeners won't know where this is, but they lived out about 8 or 10 miles from here. So there's Richland, Augusta, and Delton, and all those places out there have the propensity to get Lyme disease and ticks. That's right. And a lot of them you'll see with Ehrlichia and anaplasmosis. We just got done doing a little study on coyotes where we got some blood from coyotes, and we got 10 samples, and Of the 10 samples, we did what's called a 40X for heartworm, Lyme, Ehrlichia anaplasmosis. None of them had Ehrlichia, but 5 had anaplasmosis, and 5 had heartworm positive, and 10 of them had Lyme disease. So of the 10 had Lyme disease. So that's crazy.
That is crazy.
And that's the reservoir. That's the reservoir for Lyme in our community. One of the reservoirs, those coyotes. So, but anyway, that's kind of interesting sort of stuff. So, but you got to just start looking for stuff. Sometimes people come in and all they're telling you, and you do your heartworm check, and you maybe do a heartworm wellness profile. Everything comes out normal. The physical's normal, and then they get up to move around. The dog gets up to move around. And they're getting up like a horse. Front legs first, then back legs and stuff. Dogs usually get up back end first, and then up front first or second. And I said, well, how long have you been getting up like that? Well, for a while now. Getting a little slower. So a lot of times we'll check their liver enzymes. They can tolerate having a non-steroidal anti-inflammatory like Rimadyl, Deramax, Previcox, Meloxicam, any of those things, any of those drugs. Lots of times we have free samples to give away for that. And they can be on 7 to 14 days worth of a non-steroidal anti-inflammatory. And the people come back, wow, that made a huge difference in our dog right there. So now we're off onto that tract of we got arthritis. And are we all done when we find out that they respond to Rimadyl or Previcox or Deramax? Not necessarily. What else are we going to do? Maybe we do joint supplements. What's your understanding of joint supplements?
They help prevent joint problems?
Yeah.
The omega-3s and 6s?
Omega-3s, yep, they're an anti-inflammatory. They're what we call nature steroid. Mm-hmm. And then we have, we've always, for a long time, we've had chondroitin and glucosamine. Mm-hmm. And that's sort of been a standard thing. And now you see another stuff.
Joints.
Now you're seeing, hyaluronic acid, eggshell liners, boswellia plant, all these sorts of things, turmeric.
Turmeric, yeah.
Yeah, and so you're seeing all those sorts of things. And so I guess sometimes when you get doing arthritis, and I maybe have talked about this before, probably not totally appropriate, but it's like making Long Island iced tea. Some people make really good ones, some people don't.
Yeah.
And so what you have to do is you have to learn how many ingredients are you going to put into this Long Island iced tea. How many drugs are we going to put into this dog? Because lots of times you do the non-steroidals, and then maybe even do Librela, which is the injectable monoclonal thing for nerve growth factor. Cosequin, Moviflex, U-Move. There's all sorts of them. And omega-3 fatty acids. And then you kind of got to figure out, okay, the client has to help you with this. So like with your dog, you'd have to say, well, when I did this with Sage, this is what happened. When I did that with Sage, this is what happened.
Hers is very like hit or miss. Some days she wakes up and she's super sore, and other days she wakes up and she moves around just fine.
Well, a lot of it has to do with two things. How much exercise she had the day prior.
It's literally like random. We come to work, we go home. We come to work, we go home. And
well, then it may have something to do with the weather. If it's damp and cold makes arthritis worse. So you'll find you don't see the arthritis as bad in the middle of the summer. If it's 97 degrees and dry as a bone, not too much going on.
I feel like it might have to do with her surgery, though.
Oh, it could be.
Because she just got that coronoid.
Coronoid, yeah. Front
removed.
elbow. Yep. So it takes a while to get
limps.
over that.
Yeah.
It takes a while to get over that.
I know.
But anyway, that's the things you got to look at. And that's the job of veterinarians to ask that. But it's the job of clients to observe that.
So about what age would you want to put a senior dog on a senior diet?
Probably 10 to 11, something like that.
Way further.
Yeah.
Well, you technically said my dog's old.
Your dog is arthritic, which makes her appear old.
Does she need?
Probably not.
No.
What's
the difference between a senior diet and an all life stages diet?
Usually there's less calories, sometimes less fat, and that is why there's less calories. And it's sometimes restricted on phosphorus, which is what contributes to kidney failure. So those are probably the two big things we're looking at.
Okay.
Kidney failure, and then the weight. If she gets down on weight, she produces less.
She needs to lose weight.
Yeah, less leptin, which is the thing that causes inflammation. So fat is not benign. Have we talked about that before?
Mm-mm.
It's okay. So fat is not benign.
I don't know what that means.
Well, it means it's not. So fat can be harmful, and because it actually produces a hormone called leptin, which causes inflammation in all your joints, your shoulders, your hips, and if you go out running, the only joints you have that are really upset about everything are your hip joints and your knee joints, maybe your ankles a little bit. But if you're just heavy, your knee joints, your ankles, your hips, your elbows, your shoulders, every damn thing you own is unhappy because you have this inflammation going on there.
So is that where the glucosamine and everything comes in to help prevent that?
Yeah, and that's what clients can do on their own is to buy things, to buy joint chews. The only problem with joint chews, sometimes you got to learn to read, maybe
a label.
Yeah, you got to learn to read the label and see how much, if you got a 60-pound dog, how much glucosamine should a 60-pound dog have? We have artificial intelligence; they'll probably tell you how much it should be. But if you get the pill, if you look at the pill, there's only like, I had a pill one time that had 2 milligrams of omega-3 fatty acids. This is like stupid. Just so you can put that on the label. Because that's all clients read. They read omega-3s, and then they read 2 milligrams. It's like, well, that's probably enough, 2 milligrams.
I wouldn't know.
Yeah, well, and they hope nobody does know because it should be a hell of a lot more than 2 milligrams. And so you ask AI, how many milligrams of omega?
Oh, you use AI now? You use AI?
No, but if you ask your phone a question, it says AI driven, excuse me.
Yeah.
A lot of times they'll
Siri?
say AI driven, yeah.
Do you ask Siri questions?
Sometimes, occasionally, not real often, but sometimes.
I cannot picture you using AI.
Well, whatever.
I got to download it.
Well, the AI is not all that great because, it's fine, except, there's a lot of stuff, if it's not published, that AI doesn't know about it. So,
they only know what they're pulling from the internet.
Yeah. So we know stuff all the time that other people don't know. And we're going to go publish it just so it can, it's a lot of work to get something published. I should know that by now because we got some stuff that will blow everybody's doors off, but it's hard to get it published. And it's hard to get somebody to review it and be objective about it.
And also where you're getting your information, whether it's like Wiley.com or whether it's like some news article. Yeah.
Well, now they have AI and they got people saying crazy stuff, and it looks like it's really them saying crazy stuff, and it's not.
You mean the videos?
Yeah. But that's the thing. You got to figure out, what does my dog need? Is my dog drinking a lot of water? It's a whole bunch of things you got to look at. Is my dog losing weight? Is my dog drinking a lot of water? Is my dog arthritic? All those are need to be observed and need to be evaluated. And then once you evaluate them, then you need to share that with the client. Like when you went up and had your dog's elbows looked at, and they gave you, here's the benefits, here's the cons, here's the pros, and you decided what to do.
Mm-hmm.
Yeah, you decide what to do. And
exactly.
Yeah, and I think with a senior dog, if you had a dog you thought, in fact, you get a dog that's breathing, sometimes, and hopefully your dog does breathe, but you're trying to see what your respirations are. It's trying to see what your respirations are. Well, they're 25. Okay, 25 breaths per minute. 25 breaths per minute. Next month, 25 breaths per minute. Next month, 25 breaths per minute. Month after that, 26 breaths per minute. Month after that, 31 breaths per minute. Is your dog coughing?
It's dying. No.
Well, is your dog coughing?
No.
No, it's not coughing. Okay, but your respirations are going up. It means you may have lung disease, and what you're having to do is breathe harder to exchange air. So it's usually lung problems or heart problems or both. So you listen with the stethoscope. If you don't hear a murmur, what does that mean? Well, it means you don't have a leaky valve, but you may have other stuff. So then you take an X-ray and you see how big the heart is and what the parenchyma of the lungs look like. You just do it. You do the whole thing, man.
Do you think that it's inevitable that once a dog gets old that they're always going to have problems?
Well, yeah.
You've never seen a dog just gracefully get old and not have any problems.
Well, they all have. Well, if they didn't have any problems, they'd still be with us. So, Well,
they could just die of old age.
They don't hardly ever do that.
Really? There's always disease or...
Have I not ever talked to you about this?
No.
So what do you think the most common cause of death in dogs is?
Obesity.
No.
Me.
Me.
You?
Yeah, I'm the most common cause of death in dogs. And
That's kind of fucked up.
Yeah, I know. But almost everybody comes in and has their dog put to sleep after they're no longer able to live their life.
Oh, because you're the one euthanizing them?
Because I'm the one that's euthanized.
Jesus.
Yeah. So
I thought I was getting somewhere with the obesity.
No. Well, you are. But I mean, I put dogs to sleep because they're obese, and I put dogs to sleep because their kidneys are shot, and I put dogs to sleep because they can't breathe anymore. Their heart doesn't work anymore.
Cancer, growth, or something.
Yeah, brain cancer, seizures.
Aww.
I mean, there's a number of reasons you do this, and the client's like, I won't know when it's time. I won't know when it's time. I said, yeah, you'll know when it's time.
Yeah, you just put down, or you didn't put down my friend's dog, but she called you.
Yeah.
She had an 18-year-old.
Yeah.
Do you remember who I'm talking about?
Yeah.
T? Yeah.
And it was a dog's time, man.
I can't believe how old that dog was, 18.
Yeah. Well,
that's crazy. And I think it was like a pit bull.
If you're lucky, I don't remember that part, but I don't know. I don't hardly know anybody that put their dog to sleep and comes back and says, I just put him to sleep way too early. No, they hardly ever do. In fact, if anything, they maybe wait just a tad too long.
Yeah.
And then on the next dog, they get it exactly right. At that tail, and I always told people, the tail doesn't wag for 2 or 3 days in a row, 3 or 4 days in a row. It's probably time. Yep.
It's too bad we don't do that with humans. I feel like if I got sick and I got to the point where I was on my deathbed, I'd just want to keep us alive for the longest time.
Yeah. Well, too many people have trust funds.
Yeah.
And
dogs don't have trust funds.
No.
You make a good point there.
I can't say that. Yeah.
Pet insurance. I don't know.
Yeah.
Do you get money on pet insurance if your pet dies?
No.
Okay. I was curious.
I
didn't know if dogs could
probably
have
insure anything at some point in time. Yeah, you could buy life insurance on your dog. I've never seen anybody do it before, but
you can.
Oh, I don't know. I mean, it's Las Vegas. You can probably bet on anything.
That's crazy.
Yeah.
Yeah.
So I guess if you make a bet in Las Vegas, that would be life insurance, I guess.
Dogs don't have trust funds. That's pretty good.
But it takes people a long time sometimes to get to, and it kind of hangs over their head for a while. And it's like, well.
Because you have good days and then you have bad days.
Yeah. And somehow or another people bracket these things with holidays.
Mm-hmm.
On St. Patrick's Day, I wondered if our dog would make it to Memorial Day, or if it would make it to the 4th of July, if it would make it to Labor Day, if it would make it to Halloween, would it make it to Christmas, Thanksgiving. A lot of times that happens. I mean, we have a plethora of dogs that get euthanized at Christmas when the kids come home.
Aww.
Or on Thanksgiving when the kids come home. They want to see the dog one last time.
That's so sad.
Yep.
Are euthanizations a hard thing for you to do anymore?
No, not really. I mean,
was it hard when you started?
Yeah, probably. I mean, because I'm hired to think with my head, and they're in there all day long thinking with their heart, and so I can't think with my heart because then I become less subjective about what they're doing and why they're doing it. I had one guy come in one time, who's a friend of mine who used to play basketball with, and he was having his dog put to sleep, and the dog was arthritic, and he said, yeah, he just has a hard time getting around. I said, have you tried any non-steroidals or anything? He says, well, nobody said anything to me about non-steroidals. What are they? And then we talked about it, and I said, you could try 14 days of this and see how you do. And he brought that dog in 18 months later and had it put to sleep, but after it had joined 18 months. So it had a good 18 months, and then when the non-steroidals no longer worked. And he said, hey, thanks a load, man, for, our family got to have a dog we really loved for an extra 18 months because we discussed this. I hardly ever do it, though, because once I start to second guess them, then they start to second guess themselves.
Yeah.
And I can usually tell by what the
condition of the dog and everything.
How the dog is presenting themselves as to whether they whether they need this, whether they don't need this. Yeah.
Yeah. I feel like it'd be hardest if you had a dog brought in and it was like some big tough guy and like he cries.
Well, they do.
That would be hard.
Yeah.
Like I'd understand if it was like a woman and children upset, but like a big tough guy that you don't really normally see cry.
Well, I
would have a hard time with that.
We had a dog this weekend that had a torn cruciate ligament. This is one of our neighbor's dogs, and had bloated. And this was a 14-year-old dog, Bernese Doodle. And we went over there, and I just euthanized that dog and said, it's you got too much stuff going on in the wrong way. And he was all for that. And he was emotional about it, and that was a nice dog. He really loved that dog.
Yeah.
Yep.
Yeah, euthanizing a pet is never fun.
No, not at all. But
once they get old, you want to do those preventative measures to make sure that you can keep them around for as long as you can.
Well, and veterinarians have to understand what's hopeless and what's not hopeless. And I think that's so that apparently there's a fairly high incidence of suicide in veterinarians.
I'd imagine. It's depressing. I couldn't be a veterinarian. I shadowed with you for 2-3 years when I was younger.
Yeah.
Every summer.
But you have wins and you have losses, and you have to be able to withstand your losses and celebrate your wins. Yep.
It literally, people coming in and having problems with their dogs. My thing that made me emotional was when people couldn't afford it.
Yep.
That made me super emotional.
That's only getting worse right now. It's only getting worse.
Yeah.
And I, just to be perfectly frank with you, I think, I was at the ACVI meeting, and there was a woman there talking about doing a fecal transplant on a dog that had diarrhea, and she was so proud of herself. She charged $1,400 to do that. And I'll be honest with you, it's worth about, to me, I mean, what I would charge to do it, maybe it would be $100 or something like that.
That's crazy.
It is. And she was actually kind of proud of herself. And I don't know how you can justify that. And if this dog had diarrhea, and couldn't get a fecal transplant because they didn't have the $1,400, I guess you got to find somebody willing to do it for $200 or $150.
We had a conversation about just getting a pet and neutering and spaying it, the cost of that. Because I had friends that were getting quotes from other vet clinics that were like $800-900 to spay and neuter your dog.
Yep.
Which I think they do it at your clinic for like $200 something.
Yeah.
I can't remember.
Anywhere from $2 to $5. Yeah.
Yeah. But that was just crazy.
Yeah, I know. And
which I haven't gotten a dog spayed in a while at your clinic, spayed or neutered, because all mine are older now. So. But I just thought that that's crazy. If people want to buy a dog, just the cost of having this dog is so outrageous.
It is. But, they get stuff. And the worst thing, if they don't spay or neuter, then the neuter dogs sometimes get prostatitis, or they get perineal hernias, or they get perineal adenomas. Or
what do the spay dogs get?
Pyometrus, infected uteruses.
Oh.
Yep. And then they drink a lot of water. Well, and they may burst and die from that, Not a lot of them do that. Hypertrophic vaginas, things like that.
Yeah.
And those things will go away if you spay them, but it takes a while for them to go away. So
it does.
You have all these things that occur to dogs, and one of them we're dealing with, which is copper storage.
Mm-hmm.
And so I had one yesterday. You might get a kick out of this.
A copper storage one?
Copper storage dog yesterday. This is a lady that called here on the phone to the dog food company. And she says, well, she wanted to talk about something. And so I talked about it. And apparently her dog was a 2-year-old Doberman, and it ate a foreign body, like a kid's toy or something like that. So now this dog's obstructed. So when they took the dog in, they said, well, it looks like your dog needs smart pills because it swallowed this toy, and we're going to need to take it out. So they got ready to do it, and I think they were taking it out with a fiber optoscope. And anyway, tube pulling it out. Anyway, they did the blood work, and this dog had an elevated ALT.
Oh, and that's how they found it?
Well, yeah. And then they biopsied the liver. Bingo, bango. This dog's got copper storage disease.
Wow.
2-year-old Doberman.
That's sad. I'm glad he ate the sock, though.
That's right. He ate a toy, and eating a toy saved his life.
I thought it was a sock.
Yeah, and I think it was a toy, but I don't remember. I don't remember the whole thing, but yeah, ate something, had to have surgery, and it saved his life. And I see that every once in a while where people diagnose it because they're in there doing something. They're attacking the stomach, or they're doing some surgery on something inside, and they look at the liver and think, well, that just looks weird. Doesn't look like the liver I'm used to looking at. So they take a biopsy of it. Look what that is.
Yeah. I wonder if it's cheaper when they're in there already working on something. And then it's like, oh, the liver looks weird. I'm going to just... Yeah, does the client get charged for that?
For the biopsy?
Yeah.
Well, hell yes.
Well, if they're in there and they just see that it's weird and they decide, I'm going to...
It's time and materials. The more time it takes, the more cost. Yeah.
That's true. I was just wanted to see if they'd call the client first and ask,
if you wanted to get your oil fixed and oil changed and you had a flat tire, would they charge you to fix the flat tire?
Yeah.
Yeah. Okay. Very good.
Maybe I didn't want to fix my... No, I'm just kidding. I would want to fix it. Well, is there anything else you want to touch on with senior dogs?
No, but senior dogs, I'd encourage dog owners to to do, if veterinarians offer, if we offer something, it isn't because we need the money. It's because we'd rather catch something early than catch something late. And that happens all the time. I checked a dog yesterday, asked the lady, has your dog, have you ever seen any ticks on your dog? Nope. Where do you live? She told me where she lived. I'm like, I'm going to check your dog for Lyme if that's all right. It's an extra 10 or 15 bucks, something like that. So she did. Bingo, Lyme positive.
Do you ever have people that fight you on that when you say I want to test?
No, not really. I mean, if you present it right.
When I was there and I was a room tech for a second, I would always ask about the flea and tick stuff when you're in the room.
Yeah.
Like, is your dog on flea and tick? And I remember this one lady was like, hell no, I don't pay for that. I was like, okay. Well, the doctor's probably going to talk to you about it.
Yeah.
But I just remember like some people, you'd ask them if they're on certain preventative and they would get like ouchy about it.
Well, the same woman would say, do you ever go to the dentist? Nope, I don't go to the dentist. So, you know what, how that all ends,
Right.
with well, not necessarily false teeth, but maybe, who knows?
You never know.
I don't. But anyway, it's a good topic today, and I appreciate talking about it. And I think, if you're wondering about something, don't just wonder about it. Do something about it, okay?
Yeah. Or submit a question to us and we'll answer it.
Sure. And if your dog's drinking a lot of water and you can't get the veterinarian's office anytime soon, take in a urine sample.
That's right.
A sterile one. You can't put it in an empty mustard bottle.
That's right.
Well, you can, but you got to clean it all out with alcohol.
It's got to be sterile. It's got to be good.
Sterile. You got to get it. Listen, you got to get to the veterinarian's office in 2 hours or less. That's what you're supposed to do.
That's right.
You don't get it on Monday. Check it on Friday.
Let's get some outro music going.
Okay.
Well, guys, we appreciate you listening along with us today. We hope that we've been able to share some information that will help you love your animals, specifically your senior dogs, as much as they love you. Don't forget, always treat the treatable, prevent the preventable, and we will catch you on the next one.
Very good. Good job today.
Thanks.